So you are all very, very welcome, and I'm delighted to see so many familiar faces, but many people that I haven't had the opportunity yet to meet. It's great to see you all here. So I'm just going to give you a little bit about the Commission. First of all, I think most of you will have seen my old bake around the place. I'm Pat Cullen, I should have said, the MP for Fermanagh and South Tyrone, and I'm your chair for the evening, or I'll try my best. So the Commission is hosted by Sinn Féin. However, the panel members are independent, and anyone that knows this gang sitting on the stage, you will know that they are truly independent. They are independent thinkers, they have independent expert views, and that's really, really important to us, because whilst we host the event, we need to hear from absolutely everyone and anyone that is willing to come forward like yourselves and engage with us. So the days are over where I would see as nurses, we just talk to nurses. We want to talk to absolutely everyone that engages in this conversation. The audience tonight is from a wide and varied range of backgrounds, and we're really delighted for this, and we're really wanting to hear from you all. The Commission itself takes written submissions, and we're really welcome any submission that would be made. So please encourage either you wish to follow up on something from tonight, or encourage other people who haven't been able to make tonight to submit to the Sinn Féin website, or emailing commission@sinnfein.ie. So to the panel. When we look at the determinants of health, or more importantly, the determinants of ill health, living in and along border areas creates many challenges. We have increasing loss of primary care and GP services, with the majority of GP practices that have closed in the north have been in this area. And the north has really suffered as a consequence. This area has the greatest share of the border panel, and this has created many challenges post-partition. There is undoubtedly new opportunities to begin developing integrated services in a new Ireland borderless country. So I'd be keen to hear from you about the opportunities we have for developing sustainable healthcare delivery in a new Ireland. Particularly keen to hear how we should begin to plan ahead. So perhaps maybe I'll start with you, Father Brian, if that's okay.
Yeah. Well, thank you for the question. Thank you, Pat, for the introduction. And thank you all for coming tonight, because as you know, we're passionately involved in healthcare here now in this area. Above all areas around, we need an all-Ireland healthcare, because so far this county and Omagh has been absolutely let down by the healthcare in the north. I'm sure there are more who feel like that as well, but whatever, we just cannot continue to live the way we are. We are being neglected, and we're being made little of, and we're being pushed to the side, and it is affecting the number of people who are dying, people who don't want to go somewhere else and will die rather than face the inconveniences and the indignities that is imposed upon them. Cross-border health is just, it doesn't need, anyone with a bit of sense will know, it doesn't need any explanation. We are in an area here, Fermanagh touches Donegal, it touches Leitrim, it touches Monaghan, it touches Cavan, and all of that, as well as Tyrone, of course. But those border areas are there. And if you go to Cavan or Monaghan or Leitrim, you'll find that they have the same difficulties. They're a rural community neglected by central government. And it is absolutely necessary. Sometimes people talk about, and I think Mary Lou was quite rightly talking about, a future in the United Ireland. I can't wait for United Ireland. That's not to say that whatever else is about it. All I'm trying to say is if we wait for United Ireland, we'll all be dead, because of the infrastructures that have been neglected in this area. We need now to start worrying and talking and making sure that we can have a cross-border health service that respects people who live in a rural place, that respects people who are trying to keep their families together here, respects people, that they shouldn't be deprived of the essential services. I mean, what other health service would do this to people in Fermanagh who would say that you're not worth saving because we can't have, or you can't even get an appendix out in time to save your life? And that is a terrible thing to say. So there is no hassle, no question about it. We need cross-border services now. As it so happens, if I may indulge myself just a little bit more, as it so happens, we were involved in the establishment of the Southwest Acute Hospital, and it's opened 12 years ago. And we had a difficulty in the beginning because they said that no matter where the hospital was stated, that it wouldn't exist long enough because there wasn't a population to keep it going as an acute hospital. So we decided that that was an argument worth living in. Now, there was grave and severe and long discussion as to where the hospital should be. There were differences of opinion, and legitimate difference of opinion. But the point about it was that sociologically it was built in exactly the spot where it should be, and there was a judicial review which said the very same thing. The hospital, SWA Hospital, is where it should be. So don't listen to anyone who says it's in the wrong place or it should never have been opened. It was opened because at that time there was something in government policy in the north here to understand that a rural community deserves as good a health service as any other community. And then sometimes it needs it better. It doesn't matter what that cost is, it doesn't matter what. We're not looking for expert cancer control, that's fine. But for the day-to-day surgeries and acute centres that we need a hospital here that's functioning and sustainable and open to the people, and that helps us to do and live according to what we should do. Now, in the beginning of this hospital in SWA here, there was a cross-border element to it. It was, we developed, other experts, I was only a hanger-on at the time, but other experts were able to draw up a business plan that would sustain the Southwest Acute Hospital. And part of that was that there would be a phase 2 of the hospital, which would in fact be for cross-border health. So this is not a new idea. It's an old idea that hasn't been made work.
That's absolutely right. Thanks very much, Father Brian. Denzil, will I move to yourself?
Text obvious. Can you hear me okay? Yeah. Well, first of all, could I say a word of thanks for the invitation to come along this evening and take part in a very important debate. I'm actually fulfilling a promise. There was an event here in the Westville organised by yourselves some time back, and I promised Michelle Gildernew that I would come along, but wasn't able to on the night. So I'm delighted, Michelle, to be able to at last fulfil the promise I made to you. I don't think there's a better place to consider the problems of rural health than County Fermanagh. So I'm delighted you're here tonight to hear direct first-hand problems. We've heard a wee bit recently about one of the measurables as regards the effectiveness of a health service is life expectancy. And we've heard it compared north and south. I think I would like to drill down even more. The figures show that people who live in more deprived areas, their life expectancy is much less, and I think that certainly applies to places like Fermanagh and border counties. So it's very important that we get it right. We do concentrate quite a lot, and rightly so, on the campaign at the moment, the SWA campaign. And fair play to the folks who have conducted that campaign with such commitment. But the problems in our health service in rural areas go much deeper than simply waiting lists and surgery in hospitals. All the elements of our health service here in this particular place are interlinked. I think, for example, of the GPs, we lose GPs all the time. And that's usually our first port of call. It's a real problem for us in a place like this. I think of domiciliary care. One of the reasons why people can't go out of hospital is because they don't have a care package to go home to. My personal experience of this, I had, he's now passed away, an elderly uncle who lived between Ballygawley and Dungannon. He never married. Wise man, I suppose, but there you go. But
it extends your life expectancy for men.
Well, he lived, it extends his life expectancy.
For men?
For men, yeah. He lived to the age of 91. So when he was in his 60s, he had a brain hemorrhage, but survived. His health was pretty good for the next almost 30 years. But occasionally he had to go into hospital. Now, because he was an elderly man who never married, in fact he still lived in the house that the wee farmhouse that he was born in, we used to go up and get him. There was nobody in the area. We were in Enniskillen, my brother and sister were in Belfast, so there was nobody to look after him. He could not get out of hospital unless he got a care package. At that particular time it was brilliant. 4 people come in 4 times a day and all that sort of thing, great. But it's happening less and less, and we're paying care workers less and less, so it's going to become an increasing problem. We have a problem with our ambulance service. There are times when ambulance protocols mean that if a patient is collected in Fermanagh, they're brought straight to the Elvin, and we're left almost without cover in Fermanagh. Quite rightly, we've identified the issues to do with mental health. I'm very privileged to be a member or a board member of the Ashling Centre in Enniskillen here, and the level of help that is needed for counselling, etc., is unbelievable. It's increasing all the time, so there are all sorts of elements. What I would say about cross-border health in the future, we actually do have a very good example. There is an organisation or an initiative called CAWT, C-A-W-T, which is cooperation and working together, that was started in 1992 by the Chief Executive of the Western Health and Social Services Board in Derry, and they've done fantastic work over the years. The initiative takes in 11 counties, right? 5 counties in the north, 5 of the 6 counties touch the border. The only one that doesn't is Antrim. So those 5 counties plus 6 counties in the south, Cavan, Monaghan, Louth, right up to Donegal. It actually includes Sligo as well. So you have those 11 counties which have something like 1.6 million people and takes up 25% of the island. The cross-border initiatives that they've worked on over 30 years have included things like the Northwest Cancer Centre, where patients from Donegal don't have to travel to Galway or Dublin to get treatment. We have things like in Daisy Hill in Uri, where consultants there would go across and conduct clinics in Monaghan. So it does work, cross-border health does work. I think it was Professor Jim Dornan who said there should be no border when it comes to health, and there shouldn't be. What I would just add, Pat, is I would slightly differentiate between cross-border health and all-island health. I think all-island is a much bigger scenario. I think we're missing something here. I think under the Good Friday Agreement, one of the areas that the North-South Ministerial Council was responsible for was health, and I think because of political machinations we're losing out on that. But there are all sorts of opportunities. I think Brian's absolutely right. We can't really wait for a United Ireland. I think we need to plan for a future health service, yes, by all means, but I think there are all sorts of things that we can do in the meantime to cooperate with health, whether it be along the border, whether it be north, south, whatever. There are massive opportunities there.
Can you hear me? It's saying it's on, but what do I say? Brian here. Okay, Ben, can you hear me? Yeah. Okay. I suppose, thank you very much for the invitation. And when I spoke to Pat originally, and after I hung up the phone, I thought, what now could I be doing to contribute to that event? But I think the point that Denzil has made, I think we really have to think about being border people and think about the border region. So, for example, I manage an alcohol and drug service in Cavan and Monaghan. 2 practitioners, 1 part-time service manager, 1 2-day-week clinical administration person. That region has now joined the Dublin region, you know, under the new health restructuring, which means that we will now be competing for money with the Greater Dublin area, okay? But if you look at Cavan, Monaghan, and you look at Fermanagh, Tyrone, they're almost mirror images, because the question from Pat was, you know, let's talk and look at the social determinants of health. So the social determinants of health would say to you, if you look at through a social determinants lens, that 80% of how healthy you are and what your life expectancy will be and what your burden of ill health will be is not determined by your access to health services. It's not that they're not important, but they're not determined by your access to health services. They're determined by education, jobs, meaningful employment, educational status, access to transport, to good housing, and healthcare makes up 20% of that picture. But if we're to talk about this border region and to really start to look at it, we need to recognise that Dublin and Belfast have not necessarily been the best decision makers for regions like this over, you know, a long period of time, and post Good Friday, post Brexit, post COVID, when we've had all of these sort of, you know, major milestones that have happened. And I'm actually delighted to be here with a southern border counties sort of lens, and listening to the commonalities that people have. And I absolutely think that we don't need to wait for a United Ireland, or we don't need to wait for those things. Cross-border health has been happening across the European Union since, you know, for about 30 years. Hospital services, cooperation on cross-border basis, and people recognising and acknowledging that better healthcare can happen when leadership is right, when there is a commitment to working on a cross-border basis. So this morning I was at a meeting and did a presentation on a 6.8 million digital health project for people with chronic and enduring mental health and addiction issues. And that's going to be transformative on a cross-border basis. So there's lots of things that we're already doing cross-border, but it's ordinary people at the community level that are developing relationships based on trust, that are being innovative, and that are doing a lot with very little resources. So we've had CAUT, which has been fabulous. We have the Shared Island Unit. We have the British Irish Council. I presented to the British Irish Council drug sector group last week in Dublin, and it was fabulous because the representatives that came down from Northern Ireland, from the Department of Health, were so familiar and knew the people from Dublin really, really well, you know, and we're organising meetings with them in relation to hidden harm to children, in relation to messaging around drug and alcohol harm. And I thought, we already have relationships based on trust, so we need to build out those. But I'm also part of the Atlantic Futures group, and I think that's directly relevant tonight because the theme for tonight was about rural health. And Atlantic Futures has looked at the disproportionate disadvantage of communities west of the Bann and west of the Shannon. So from the north tip of Antrim down to Limerick, we have seen chronic underinvestment in health, in housing, in infrastructure, in jobs, employment and enterprise. So it's really, so I'm actually really glad to be here tonight, and thank you all for coming. I'm going to stop now because I want to hear what everybody has to say. But I just think that the leadership has to come from people in these communities and people in this room. And I think that, you know, if we trust each other, if we create, if we innovate, that there's so much more that we can do.
And that was fantastic to listen to the contribution of you in the first question. So now over to yourselves. If you want to put your hand up, I'll be able to see you. We have 2 roving mics. we have Stephen and Andrea. Stephen at one side, Andrea will be at the other. And if you put your hand up with a question, a comment, this is about a conversation. We also want to hear if you have concerns about the future and how we're moving forward, or your solutions as well. So we've got one hand here, a hand at the front. Stephen and Andrea will come to this person.
Oh, thank you. My name is Paula Leonard, Edushin, Oscarga. I'm also from Balak, the way of the Flagstone, same place as Brian. And just as a sidetrack, Brian used to take me at 4 years old up to Moneymaster School. So I'd like to say thank you, Brian. Even then he was trying to help people. My question is, when I was in USA playing some music, I had an accident on my bicycle. I ended up in San Francisco General. And when I was leaving, they told me, to give me some discharge notes, that I had concussion, a dislocated shoulder, and 3 broken ribs. Oh, and you also have leukemia. Now, I had never heard of this before. So I thought I'd better get myself back here, and took myself up to the city hospital. And the guy looked at a big screen and he says, "Oh yes, you do. There it is. 8.5 years ago." And I said, "Well, how come I don't know?" And he said, "Well, we weren't looking for it." So then I thought, what am I going to do now? I waited and waited for something to happen. And I started looking at my green card. So I had a green card, because playing music, they decided they want me over there more often. So they gave me a green card, so I could go anytime I wanted. So I thought, I'd get my green card and I'd go back to Zuckerberg, San Francisco General. And now I'm standing here with almost certainty that if I hadn't done that, I would be dead. I would not be here. I've had 2 appointments with 2 doctors since. One was with a doctor from Nigeria, and the other was with a doctor from Sudan, the Republic of Northern Sudan, where there's 13 million people displaced and 24 million people dying from starvation, women and children. And yet we have to go to places that are needed and bring them back here so they can talk to people like me.
So, thank you. So your question is about...
So my question is, should everybody get a green card? So they can
Well, we'll answer that. Thank you very much. So I'm going to come to the lady in front, and then I'll come to Jimmy at this side as well. So.
Hi, thank you. My name's Megan. So I represent inclusion. My concern for this strategy is what resources are going to be made available for the autistic community. I work for a company, I'm going to say it, Cubby Sensory Hub, and we are committed to transformative change. Across the Republic of Ireland, there has been significant changes across every rural area possible with Cubby. And I think it's time that we recognise sensory processing as a disability. I know there are mums locked at home that physically can't leave their home because of the sensory processing issues from transition from home into community services. So I really truly believe the strategy needs to have a commitment towards the neurodiverse community and the implementation of accessibility and resources. So I suppose I wanted to just raise that issue. Very passionate about it, and hope that would be listened to.
Thank you very much, Megan. We've met several times, so it's good to see you here. So thank you. And Jimmy, we'll take a third question and then we'll come to...
Thank you very much. I'm Jimmy Hammond. I'm with the Save Our Acute Services campaign. There was an article this week in the Irish News by Deirdre Heenan, it was actually on Monday. It's titled "Cross-Border Collaboration in Health is Better for Everyone. So why are we not doing it?" The article, it's critical of the political progress so far on both sides of the border. Okay, it's also critical in particular of the slowness that it takes and the length of time that it takes for any cooperation or collaboration to be brought into place. Okay, there's only one hospital mentioned in the article when Deirdre Heenan says the Southwest Acute Hospital in Enniskillen presents substantial opportunities for innovation in respect of service provision on a cross-border basis. Now that's really important to us, certainly in this community here. I think that chances are that everyone here in this hall believes in SWA. Okay, and it's good to see that Deirdre Heenan does as well. But it's also clear that to date, the key decision makers do not believe that there's that kind of an opportunity for innovation here. There are two very important words, opportunity and innovation. We'd add a third word to that, and we'd say urgency, or rather the lack of urgency. The question that I do want to ask, and it's a reasonably long question, but it's just, in the current context of a shocking collapse of key aspects of many of our health services, how can an All-Ireland rural health and care service help us now to get our message across of SWA being an opportunity for innovation, to get that heard and acted on before too much time has passed and the hospital services continue to be stripped from here and the staff continue to leave? Thank you.
Maybe we just take those three, I suppose, some comments and those two questions together. So what Jimmy's really asking is, how could SWA become almost the exemplar for us moving ahead with the development of services within a new Ireland? Those services that should be developed within a borderless country, Father Brian, Denzil and Paula, and we actually could lead the way here. And where do we start and how do we start to plan?
Well, two of my colleagues have mentioned CAUT here, and I understand the theory and philosophy behind CAUT, but it has been of absolutely no value to us. It has everything in this Western Trust has gone to Altnagevan and Derry, and I'm delighted for them. But I wish that it remembered us as well, who are in a position, as we all say, and have the hospital, have the best hospital in Northern Ireland, individual rooms for everybody else in it. 92 rooms in that hospital are not being used. There's a wing of it not being used. And so we can start today by having, I presume it takes political insight. I don't think the medical people can do it on their own. But if any politicians from whatever party, including Sinn Féin, they should be able to make a move and say, look, we can do a programme here to test out what cross-border is like. We have the hospital, we have the facility, we have the plan. It was planned in the hospital, and it can be done now. And unless that is done, it'll be another disappointment for us, because no matter what happens, rural people are being neglected, no matter where they are, and particularly in this area. They're being neglected in every way. We don't have GPs, we don't have a hospital, we have a great hospital, we have people who want to work here, can't get working here, there's GPs who want to work here, there's obstacles put in their way. This isn't just neglect, this is a conscious effort to ensure that this area, stuck in the middle of a cross-border area, is left to, quite literally, many people are dying because of it. That's not right. That's not fair.
Yeah, my recollection of, if we could go back a wee bit, as to why SWA was built in Enniskillen, and I do remember being a journalist at the time and covering the story. There's quite a controversy. Would it be in Enniskillen? Would it be in Omagh? My recollection of the Morris Hayes report was that the key factor in citing it geographically in Enniskillen was that too many people would be left out.
Yes,
if it was in Oma, too many people would be left out of what we used to call the golden hour. You had to be within 1 hour of an emergency service, and that was the main reason. That seems to be almost forgotten. But the other key point was that there was, I don't recall what Brian was saying, but I do recall that it's such a small, even when we take in Oma, and there was suggestion that we might get some patients for specialties from Craigavon, but because it was such a small area in population terms, for the hospital to remain sustainable, there would be a cross-border element where we would have Cavan and Monaghan coming in. That hasn't happened. That hasn't happened. So, in fact, I read recently a report from the Department of Health at Stormont, where there were references to SWA, and they seem to stop using the term acute hospital, or start to talk about a general hospital now. So if we want to apportion blame, I think the leadership politically and the leadership from within the health service has been very poor in isolating SWA and not making the full use of it. I would also say, if we do look ahead to an all-island strategy, it always amazed me why we are linked in with Derry, who really, if you look at the island of Ireland, I think if we want to stay within the north, you would be looking towards Craigavon and Belfast, but we seem to be having people in Derry taking decisions. I'm always amused. I used to have these arguments. I hope there's no Derry people in tonight. But,
I hope there is.
hope there is. But Derry people complain a lot about everything centralised in Belfast. When it comes to the university, etc., quite right, absolutely right. But there seems an irony to me that when they are starting to take decisions about where things are centralised for our area, they're quite happy to grab everything themselves. So if you look at a future strategy for an all-Ireland health service, and we look at regions, we should be lumped in with Derry. We should have this region where we have Cavan, Monaghan, maybe Sligo, whatever. And I think one of the plans, as I understand it, for a future health service is that we have centres of excellence. I think a lot of the stuff that we do going forward will be about, as long as we can get in your hometown, a decent GP, a decent emergency service, etc. There are basics there, but we will accept that we would be prepared to travel for things like, specialist cardiac surgery, cancer, all that sort of stuff we can travel for. But that, if you look across the island, we need centres of excellence, and I can't think of a better place than the facilities that we have in Squire to create a centre of excellence for something.
Paula?
I'll be very brief on this one. But you said, are there any Derry people here? So full disclosure, I'm originally a Mayo woman who lives in Donegal, but I'm 5 miles from Derry and lived in Derry for years. And Brexit was sort of the reason I migrated back across the border. But just in relation to, going to Antnagavin, I drove that road tonight, and your 1 hour, rule, you're very far from that 1 hour rule. It's a horrible, horrible road, even on a good evening, and it's a beautiful evening to come down through lakes and all of that, but to drive it on a horrible evening like this evening, it is ridiculous to think that people in this region would have to.
Here.
On the other hand, when we think about the broader context of cross-border health, the fact that people from the far end of Inishowen, and I live at the foot of Inishowen as well, the people from the far end of Inishowen are now getting quality cancer care in Antnagavin Hospital. So if you live in Ballyshannon in South Donegal, you could be in Galway, which had been your option, in 3 hours. If you were coming from the far end of Inishowen, it was 4.5 hours. So that's a 9 hour round trip. So we have to celebrate the wins, and we have to, you know, not look at them sort of in that, oh gosh, what they got, because it has improved the quality of healthcare around various things for people who were experiencing rural exclusion. So, you know, let's think about the people of Inishowen and the far end of Inishowen and what that's done for them. And let's say, how do we apply that decision making to here? You know, how do we talk about people in the region? How do we talk about people in Cavan and Monaghan and the original vision that people in Cavan and Monaghan would be included? And I'm going to leave it at that.
You know, thank you.
Yeah, just a quick one. Let me say, I have no objection to the people of Derry living. I have no objection to the people of Derry getting good mental health care. I have no objection to them having a great time when they go to their ED service. My problem is that I don't want to go to it. And I shouldn't have to go to it. And I shouldn't have to go to it. That's the point. And the whole point is that we need cross-border. What I would like to see and want to know, see, we're going to live in a new Ireland. Doesn't matter whether it's United Ireland or not, it's still going to be a new Ireland. The old Ireland is dead, and it's not coming back. And we have got to make sure that we don't try to squeeze the new Ireland into the old regime. If we do that, we're finished. Look at what's happening throughout the country. Throughout the country rural areas are being deprived of GPs, they're being deprived of banks, they're being deprived of schools, and now they're being deprived, they're now deprived of religion and churches. Total neglect, which proves to you that the old system doesn't work. So I think if there's going to be a new system of an all-Ireland or cross-border or a new Ireland, all of those words are understandable, if there's going to be anything, if we take the old institutions and try to squeeze the new Ireland into them, we're doomed to failure. We have got to scrap the whole lot of them and start from the word go for 7 million growing people with a great absolute economic value, with great young people in the future, with great vision in the future, members of Europe and part of Europe, and we have got to see that this is a new place.
Here, I'm coming to Laurie first. Laurie McCusker, go back.
Can I?
Yes, okay. Now,
Can I just?
and again, short and sweet, if you don't
Yeah,
mind,
just-
I really do want to hear from
I just
you.
wanted to come back in on. Oh,
Is that number?
I don't know.
Here you are.
Somebody's trying to shut me up. Just, I don't want your point to be lost in relation to neurodiversity, and I think it's really important just to make a note that the Institute of Public Health is leading right now, and the Departments of Public Health, on an all-Ireland needs assessment in health. And I think that it's really important that those sorts of needs are also captured. That's short and sweet.
Thank you, Paula, that's important, thank you. Okay, so we're going to go to Laurie, and then I think Michelle was next with her hand up. Laurie.
Thank you, Pat. What I'm hearing tonight is about common sense. You know, if you're in Belcoo and you need emergency, you shouldn't have to go to Alnagelvin or Craigavon or Belfast. There's places closer at hand in Sligo. Same in Newtown Butler. Same in Rosslea. Same in Ballyconnell. You know, we're talking about common sense. And what was interesting when this evening's discussion opened up, and Mary, you referenced some exemplars of cross-border healthcare in action. Because it makes sense. In fact, I wouldn't be standing here only for I was able to avail of cardiac surgery very, very quickly in Dublin. Because it made sense. Now, for some reason, there's public policy makers who don't have common sense. Because if they did have common sense, a lot of the issues which we've touched upon tonight would be already dealt with. Just like the people up in North Donegal accessing services in Alnagelvin. Just like me accessing services in Dublin. Because it makes sense. Now, somewhere we have to get to the bottom of the root cause of why some public policy makers at a senior level don't have common sense. And let's talk about money. Because when the Chancellor stood up in London today, the immediate response from a number of people in this part of the world is, it's not enough money. Well, in this part of this island, we spend over 50% of the public expenditure on health. It's a low percentage in the south. But by God, common sense means when you work collectively and collaboratively and you put that money together, you get a bigger bang for your buck and you get better outcomes. And this comes down to leadership. And some people may reference political leadership in this. And political leadership is really important. But equally important, in my opinion, is those who lead public organisations who, for example, in the case of SWA, after 3 years, can't even produce a plan. Yet, a community-based organisation can produce a roadmap. Our local authority is due to release a major document which also outlines a similar type of roadmap. And in both cases, the local authority, my understanding, and the source group have produced a roadmap which includes active cross-border health. And you know why they've both done that? Because it makes sense. So I suppose the challenge we have, and we all have this challenge, is how do we get those who don't have the common sense to look at how people in Belcoo are far better accessing services in Sligo than in Albion. And if we can crack that nut, just as it's cracked the nut already with cardiac, paediatric cardiac, and in terms of the cancer services up in Altnagarvan and for Donegal. We should be building upon that, and we should be insistent on our public policy makers that they build upon that. And they shouldn't be able to hide behind a lack of political support to do that. Thank you.
Totally agree with everything that you've said. So I'll move on to Michelle.
Thanks, Pat. First of all, can I thank the panel for being here tonight for this very important discussion, and Pat, well done for facilitating it, because we do, in this border region where we're sandwiched between the east corridor and the western corridor in Derry and Donegal, we're very vulnerable in the middle. I want to follow on from Denzil's point when he talked about a centre of excellence, because we don't have a centre of excellence, but we do have an excellent centre in the South West Acute Hospital in stroke services. And 3 years ago, my husband took a stroke. I asked the paramedic to take him to Enniskillen, and she said he wouldn't make it, and he was less than an hour away. And if we lose those stroke services in Enniskillen, we are condemning a group of people to being a lot further away from a good stroke service, and people will die as a result of that, given the very clear need for time. I appreciate if it's congenital paediatric cardiac services, if it's radiotherapy or specialised cancer services, we can travel, but for stroke, it's very time limited, and we do need to recognise that and continue to keep the pressure on there. In terms of the North-South Ministerial Councils, because some of the panellists have mentioned that too, Barbara de Bruyn was the Health Minister in the first executive and was absolutely pioneering and put a vast amount of areas of cooperation into the North-South Ministerial Council on health. And she knew the benefit of working collaboratively and collectively on the island of Ireland. And unfortunately, the North-South Ministerial Council has been a victim of the cold dead hand of political unionism, in that they've diminished and diluted the role of the North-South Ministerial Council. By now we should have areas of cooperation on climate change, on mental health, on hospice and palliative care. We should have areas on, on people trafficking, on drugs, all of those things. We should have areas of cooperation, and we don't. And we need to keep building those infrastructure tools that we currently have and make them start working. And we know, and I know as a Tyrone woman, South Tyrone's proximity to Craigavon was its death knell, and it was closed because it was too close to Craigavon. As a Tyrone woman, I got dog's abuse every time I went to a football match or a funeral because I was supporting the hospital in Fermanagh, and I recognised that the further away it was from Alton but also the closer to the border, the better chance we had of keeping it sustainable. And again, that 20-25 years has seen a big disappointment in terms of decision making. But in terms of Laurie's point in common sense, unfortunately, decision makers are putting value for money into any kind of spec. It discriminates against us, because the bigger the population, the more value for money you get, the more people you reach. So that has to change as well. We have to stop putting value for money in, because rural dwellers will be left behind over and over and over again. And I think we need to keep this discussion going. We need as many people as possible to have their say, as Pat has given out the email address there earlier on. Health is the most important thing that we've got on this island, and your health's your wealth, we all know that. And we do not intend being left behind, and we don't intend being second-class citizens. So well done on all of the contributors this evening. We could talk about this for hours and hours and hours, and I just want to keep this conversation going and to try and improve the health outcomes and the life expectancy outcomes. And we know it's a very stark figure that if you live in the 26 counties, your life expectancy is higher than if you live in the 6 counties. And that's not just years in your life, but life in your years as well. So, Gurmila Malvin.
If you think of what we've heard from Laurie and then from Michelle, we could be the leaders of the change that's required, because we've got the infrastructure. Although we don't have we may lack road infrastructure and other types of infrastructure, we've almost got the health template for delivering and driving forward.
Yes.
So how do we make that happen is what I'm saying, because if you listen, panel, to what's been said in the room tonight, there's not a dissenting voice to understanding and needing and actually saying there's no other way forward but having a new Ireland approach to delivering health, particularly in rural border areas, and that's where we should be starting. So how do we make it happen? And what's our role in that as leaders in the community? Because we're all leaders in our community. Some of us are political leaders. I would see myself as a nurse leader as well. So how do we make it happen, and who do we drive that pressure to and with? Brian.
Pat, you're asking the right question. But you know, we have tried in this area to be listened to. We've made an absolutely brilliant case, not because an emotional case. We've drawn up a plan, but nobody is listening to us. What I want to know is, how can we unite the rural people, north and south, Protestant and Catholic? How can we get ourselves to be interested in our own health and future? And if enough of us stand up to it, enough of us will achieve it. But there's too many divisions. There's too many divisions in political divisions, and too many north and south divisions. And you know, to be honest, I have to say it. I don't mean this. This is great. It's great that Sinn Féin is doing this, but because Sinn Féin is doing it, probably the UP won't agree with it. That's as we see it. You know, that's what we see. That may or may not be right, or may not be wrong. But in the meantime, who falls between all the stools is the people here in the room and the people at home who are not able to get out. We have got some way to get a system where the ordinary people in rural Ireland have their voices heard. That is not happening now. We don't have the big bucks or the big money, and I can't understand how where Brexit was a difficult and terrible thing here, but at least, you know, the European Union WHO should be doing something. But WHO are what? They have been destroyed because Trump has destroyed them. So the big money, the big powers, the big bullies are still destroying our lives. And we have got to find a way to have our voice heard. I don't know how you do that, but we have got to find a united voice for a new Ireland that will bring about the health service that we deserve. That's what we do.
Questions or comments from the audience.
Thank you. Good evening. My name is Stephen Orsby. I'm the Healthy Ireland Coordinator in Cavan, but I live in Ireland here. And Paula, I work a lot with Paula, and I previously would have worked for Denzil at the Impartial as well. But I suppose a couple of points just I want to put to the panel. The first one is I'd like to hear their thoughts on what it means to be resilient. And Father Brian touched on the WHO, and the WHO feeding down into the Healthy Ireland framework, feeding down into Sláintecare, healthy communities in the south, talks about a systems thinking approach. And that's essentially what we're talking about here tonight, is thinking about the overall health system across the island. Resilience, we've heard it a lot through the years in the north of Ireland in particular, that we're a resilient people. But that is on the basis of saying that we were resilient coming through the troubles. We have to move away from that. Resilience is about decision makers at government level, at local level, actually empowering the people that live in our communities to actually reap the benefits of health and well-being in their own communities. It's about giving people the tools in local communities. And Paula talked a bit about local communities driving the agenda. And Brian has talked about how do we do that. It comes from actually government and decision makers giving us the tools that we need as communities. So the likes of the Healthy Ireland Fund, it's €75,000 a year. But what they're telling me that I have to do is that I have to work with every agency in the south of Ireland. I do cross-border work as well with the likes of the Ark Healthy Living Centre in Irvinstown here and different communities on the border. That's okay. But the budgets aren't there to deliver meaningful interventions in our communities. The second point on that, do we have too many strategies? And Paula will recognise this. We have a strategy for everything north and south. We seem to be obsessed by strategies. The ordinary people in this room, I'm sure the majority of us, don't give a toss what's in a strategy that might be 120 pages long. We don't. We look for the detail. It's often in an executive summary that you can read an executive summary and say, I don't need to read the rest of the document. I know they're not going to provide recurrent funding for Healthy Ireland programmes, for alcohol and drug abuse interventions. That's where the gap is. The gap is between aspiration and actually delivery. And delivering for people on the ground. And allowing people to have that ability to make their own decisions based on knowledge, information and resources at a local level. Properly resourced so that we can put things in place as communities that allow us to improve our health and well-being. Thank you.
Thank you very much.
Hi, my name is Evelyn. I work in the health service as well. My question is really to Paula. She described something very interesting about cross-border work, particularly between Cavan and Monaghan and obviously Donegal and Derry. She mentioned that they engaged with areas around Dublin because obviously drug and alcohol work that she did. I mean, there's trailblazers in these communities that manage to do this. And we need to be talking to them. We need to find out how they got the budgets. How can we decentralise the budget that is put aside for health that only reaches certain places, both north and south of the border? We have a right to do that. We have a right to see that the spending is put into the services in our area. And that's all I can say, is that we need to engage with those people who've been successful, and Paula probably knows them really well.
Thank you very much. Paula.
Mike, who thinks I'm leading a digital health project, but here you go. Try this one. Says it's on.
Can you hear me anyway? No. Oh. Can you hear me now? Yeah, I've got it. You hit it twice, that's okay. Look, I think Brian probably, for me, made a really important statement earlier when he said, we have to think about just not all island, we have to think about cross-border. And I think it's really important that we have that mindset, that we start to think about what does this look like as a region? What do we look like as a region? What is the sensible, common sense, like the gentleman down the back, what is the common sense approach to the delivery of quality healthcare in this region? So, in a way, the border is just a line that exists. We are people who have very similar issues, and Stephen would know, you talked about suicide and you talked about life expectancy. Cavan and Monaghan have the highest rates of suicide in the figures that they collect in the National Office of Suicide Prevention, year on year. That is not a league table that you want to be the top of. Every year Cavan comes out top and Monaghan comes out the back. There are interesting things that happen with that, because largely speaking, you're talking about the profile of people at the highest level of risk of suicide are generally middle-aged men. Rural men and rural farmers also feature. There are several other risk factors. But when you look at Cavan, you are looking at a younger age profile. Why are we letting the people in this region down? Now, I do think that, the restructuring of the health services in the Republic, there are things that we have got to demand through that, because budgets are moving out from Dublin and budgetary control is moving out from Dublin back to these new regions. I think that there is a period of opportunity now to start talking to those people to say, what can we do in relation to the allocation of resources on a regional level? The head of, the Assistant National Director for EU and Cross-Border Health is based in Ballyshannon. These are conversations we should be opening up and we should be having and really talking about it as a regional basis. Because if we only talk about it on an all-island basis, that will not break down centralised decision making and centralised power and control of budgets within our health. And I think we have to push further than that. And I think that, you have the chair of the Health Committee here tonight, and I think that there's opportunities, what conversations are they having cross-border? What conversations are they having now? And just, there's something about mindset. At the moment, if I wasn't here, I would be busily filling in a funding application, for a support for national organisation. That goes into Dublin. I was looking at it and I went to a webinar the other day about it. There is nothing that I can count on any of our cross-border activity that will score me any points when that funding application is evaluated. They will only fund me points for working with Ballymun and Listowel and Cork City. And you're right, there are trailblazers. The only reason we have community-based drug services in the Republic of Ireland is because people took to the streets and demanded them. And they demanded them when the rate of heroin deaths in the Greater Dublin area was the highest that it was in Europe, that there ever has been. And it was mammies with prams, and it was people who said, we need locally based health services. We absolutely have to have them. And people power is our greatest strength.
I like Larry's contribution there. I suppose it's the old saying, isn't it, that common sense isn't all that common. I would also, I feel, Stephen's passion for his point and his frustration. I think that's a frustration that is shared by many, many people. And it's not just health. Public services here, I think more and more people, especially in this area where we feel forgotten, but I think generally people are more and more frustrated, with all due respect, with Stormont for the failure to deliver public services across the board, not just health. What's happening with the A5, casement, you name it, all sorts of infrastructure, what is happening? And I think more and more people are getting very, very frustrated with that. But, Paul is right, the power of the people, the voice, we have to keep raising our voices to let them know. And I think there's a danger with Stormont that more people will become so frustrated with it And I think I hear people, there are conversations going on all the time in the community that I come from that would surprise you, which political unionism isn't taking account of. A lot of people will talk about, it's not necessarily the big constitutional change conversation, but what if the border wasn't there? Why are we not cooperating more? All those sorts of conversations. I was extremely interested, if I could divert for a moment, Pat, the comment from Alan Stout this week about GP services. It was very interesting. He opened a conversation there about GPs in the north maybe becoming part of an all-Ireland GP service. I have to say I wasn't entirely convinced by what he said. I think there's a huge conversation there. That sounded like a wee Trump huge, didn't it? Huge. There's a huge conversation because what you've got is two very different systems, and how do you integrate those two? Do the GPs leave? Alan Stout was on radio and he talked about, you pay €65 in the south for a GP appointment, but actually it's only 20. And I think we have to be honest and say, would we be prepared to have a system where we would pay for GP services, or pay for, if we got a good service, would you pay for it? Big conversation. But integrating the two systems, where you have in the south, where you have a two-tier system of half private and half medical card, and in the north we have free at the point of use. It's interesting that it's actually maybe almost reversing what you have now. Sláintecare would have a free at the point of use service, whereas I think in Britain, with people like Farage and so on, we're actually heading towards the American system, so maybe the two systems will reverse. But it's a big, big conversation. I think it's an opportunity to have that conversation, and I think I would really like to see the government in the south leading that conversation. One of the things, for example, I think it was about 5 years ago, there was a Life and Time survey here in Northern Ireland where when they were talking about health service, 52% said that the free NHS service would be a key factor for them in a border pool. So even with the state of the NHS at the moment, people still think, well, we get it free, so I'm sticking with that system. So it's a big, big conversation is what I'm saying, and I think we have to have a vision for the all-Ireland health service. We're not getting that vision at the moment.
No, that's a very, very fair point. We've got another question. Thanks for that, Denzil. We've got another couple of people at the back that have got their hands up, and perhaps maybe somebody in front, but I think Stephen will keep you right. Over to yourself.
So my name's Joe McAleer, and I would have a pharmacy out in Belcoo, and I've also a pharmacy here in Enniskillen. So I would probably touch on a lot of the points actually Denzil was touching on. And I suppose when I would look at this conversation, I think there's two aspects to it. We have an all-Ireland aspect, that Denzil has said earlier on, which is looking at really secondary care to me, which is looking at your centres of excellence, your hospitals, your specialist care, and that's a no-brainer. We haven't got the population of 9 to support anything else. We need to bring this all together, and I think nobody in this room would disagree with centres of excellence and bring it all to one roof, so specialist care in the right areas. But we've also then, probably at the local level, we've got the cross-border element, and again, to me, that's more down to primary care. That's down to GP services, pharmacy services, dental services, local services here for mental health and everything, so there's nearly almost like 2 different conversations going on. Big problem, I'm going to touch on primary care, because that's where I'm based, so the big problem with primary care fund is funding at the minute, because it's all started to be based on a volume model. And the problem with areas in Fermanagh is we have a lot of small areas. You look at all the villages with Bleak, Garrison, Newton Butler, Cache, Bricktempo, it's all small populations. So the problem is when you move to a service-based model of payment, it doesn't. We don't have the volume of services there or interactions to pay for the services, and it means then that every single interaction means we're losing funding, and core funding's being eroded, and pharmacies and GP services and all the local services are all struggling then now to stay alive. And even a pharmacy, with 25 pharmacies closed in the last 2 years, you know, so it's becoming a model that's not sustainable, and I know Philip's been well aware of all that as well, you know. So the problem then with this funding model is the brain drain. Like, with a massive brain drain down to the south, you know, because of the funding inequalities, you know, it's affecting staffing levels, support staff, staff time off, stress levels, you know. Friendly with one of the consultants who used to be up in A&E, and he was telling me that there's 6 or 7 consultants that used to be in A&E in Swar now and A&E in Cavan. You know, and that is a crazy situation, and that comes down to staffing levels, support staff, funding, wages, you know, it comes down to it all, you know, and we're losing that brain drain. It happens in pharmacies, it's happening in GP land, it's happening everywhere. We're losing a lot of valuable medical services just because the funding's not there in the north to sustain it, you know. So I know from us acting on the border at the minute, you know, we act as a 3I service, you know, because there's no other services available, you know. So we've dealt with people suspected heart attacks, serious falls, accidents, you know, calling into the pharmacy. The first call they make is to the pharmacy because they know no other service is going to get there in time. You know, we don't have a GP local, you know, our GP unfortunately is in Blacklion, but it can't be used by people from the north, you know. So it's a crazy situation when we have one part-time surgery in Blacklion with part-time surgeries in all the local villages. If we bring us back to primary care, why couldn't there be one GP looking after the whole area, you know, or one GP practice, you know, and supporting the staff, supporting patients in the north and the south. Same as the pharmacy services we're supporting patients on both sides, but we're funded from the north. We're not getting funding from the south, you know, so our fund to support that area comes from the north. It should be coming from both areas, you know. So suppose what I would call for is my solutions will be collaborations to allow the GPs to amalgamate, you know, and other maybe services to amalgamate, you know, whether that's mental health, whether that's wherever that funding comes from north and south, you know, to support these services because they're supporting people on both sides of the border. They're not supporting one population, and we haven't the population there, but if they could support populations from both sides, when we are in a small area, that would make everything more sustainable. Similarly, I suppose from pharmacy, collaboration, legal changes to allow us to service and dispense prescriptions for populations both sides of the border makes our pharmacies that are around the border a lot more viable, because at the minute they're not viable and they haven't been for a long time. And then I suppose that for the Irish government to help fund rural primary care services along the border, you know, to help these vital services and to support both sides of the border, support both communities. When we haven't, the communities are there, but in small numbers, you know, so it has to be a different way of funding everything.
Thanks very much. Joe, you've just summed up the urgency in taking forward the plans that we need to put in place, and we can't see a repeat of what happened in SWA and what we're seeing within general practice. 30% of all general practice surgeries that have closed in the north over this last few years are within Fermanagh and West Tyrone. And that is really, really significant, and it's one we can't ignore. The same as what happened with emergency surgery in SWA. What we're doing is waiting until services collapse, when there's an answer staring us in the face, and that is we need to have an all-Ireland health service to make these services viable. For a population of 7 million, we're never going to be able to move forward. And I can speak from my own experience of, and I was very, very lucky to be the nurse that led the commissioning of the paediatric cardiac surgery that's now seen as the most exemplar of all Ireland services. That was a service just about to collapse, and because we were only operating on 103 wee babies in Belfast, we were going to lose people like Professor Frank Casey and others who are world-renowned surgeons, and the answer to that was an all-Ireland health service. And how did we make it happen? We made it happen because the people demanded it. People like Helen and Jimmy and others in this room that are leading the campaign now with SOAS. The people, the mothers and the fathers and the families of those young babies insisted on a service being delivered close to home, instead of having to transport their premature babies over to Nottingham and Birmingham, and that's where we were taking them, and the implications of those babies having to fly and leaving their families at home, women having to stop breastfeeding, all of those other issues. So people, the community demanded it, And then it became clinically led, clinically driven, listening to the evidence and the science, the same way as we should be listening to the evidence and the science around the absolute need for an all-Ireland health care service. It's staring us in the face. So we listened to the evidence, we listened to the science, the clinicians were front and centre. And then what we had, and I was part of that clinical group, then what we had was the politicians, Michelle described, people like Barbara de Bruyn, who absolutely got behind it and made it happen. And we've got that model of success. We need to have the will now from the Irish government to make it happen. And I don't think, knowing my colleague Philip McGuigan, and certainly knowing our leader Mary Lou McDonald, there'd be anyone wanting on our side to make that happen. So thanks for that, Joe, because it really did resonate with me in my previous life. But another question.
Just a comment.
Comment.
Paula mentioned earlier that 80% of health is not about access to health services, but about social factors and addressing those. And we talked about COT earlier and how they were an example of good practice, but I think as well our community and voluntary sector are also examples of good practice within that, and they're working really effectively on a shoestring budget to deliver services within their communities that are meeting needs and trying to I suppose stop people having to access health services and to improve quality of life and health expectancy and life expectancy. And they're doing that by collaboration and by talking to the people within their communities, looking what the need is, listening to what's happening in their communities, what those people are saying, and addressing that need. And I think that's something maybe we need to go back to as well in terms of health services. Thank you.
Are there any other questions? Yes, Stephen, thank you.
My wife's a GP, and my wife worked in the area, some of her colleagues are here, in the area where 4 practices around her practice collapsed. And overnight, her practice was great practice with 7,000 patients, fully staffed, everything. And suddenly, Rosalie, Newton Butler, Maguire's, they all collapsed. And they went to 14,500 patients with no extra resources or nothing, with all the promises in the world from the politicians and from the Health and Social Care Board, the SPPG, or whatever it's called now. And the cavalry's coming, and it didn't come. And I seen my wife, and I'm sure it's the same for her colleagues, the clock going off at 7:30, at 7 o'clock, at 6 o'clock, doing scripts and home at 8 o'clock, 9 o'clock, 10 o'clock. And it went on for years, and the finish up, they actually were still fully staffed, and they just handed back the contract because there was nothing happening. That's listening key. But the reality of our health services is 9 out of 10 presentations to healthcare is dealt in primary care. Yeah. It's dealt by your GP. So when we talk about all Ireland, rural, urban, deep end, it's the GPs, practices, and the MDT around them, and the community and voluntary sector, and home helps, and everybody who links into that infrastructure deals with 90% of the presentations in healthcare. In Northern Ireland, they're supposed to get 9% of the budget. It was supposed to go up to 11 of UK. Pat, you'd be familiar with this. The last audit after COVID and everything, they got 5.4%. If you want to know why GP services are collapsing in Fermanagh, this is the canary in the coal mine for health services. But on a positive note, if you were to ask me, and definitely ask my wife, who's involved in teaching and training in Queen's now, because she recognised the problem was in recruitment was, how would you get someone to come to Lisnaskea or to Garrison, where we're from, or to Balik, if they're trained in Belfast or in Dublin, if they want to go? It's the exact same problem in the Republic, getting people to rural areas. If you can solve the health conundrum in rural and isolated areas, and it was, the evidence is, if you train undergraduates and bring them out and expose them to rural areas, there's a good chance they will do postgraduate training and they'll come. And that's the exact same problem the SWAT faces in acute services. They can't retain, they can't recruit, so they're wasting a huge budget on locums, but general practice is exactly the same. And if there was something to be done, and it can be done cross-border, whatever way, on both sides of the border, there has to be workforce planning, and it has to go back to basics, and it has to actually get people from Fermanagh that study medicine, study nursing, study pharmacy,
that actually their placements are back out in this area, in acute setting, in primary care settings, and that they come back out to the local area where they are rooted and invested in, and you will solve the workforce crisis. And that's been looked at all over Europe. I know all this because my wife's the RCGP rural rep, and she dispatched me here today.
Good stuff. Well, she would have been very welcome to come here.
But it's on, we talk a lot about problems. If you were to take anything from this meeting, I would say workforce planning north and south, and align them at undergraduate level, and map out what the needs are for the rural communities. And if you can solve rural community issues in Ireland, north and south, the border will dissipate. We'll deal with the other issues, because Denzil made a point about COT, and I had a very interesting meeting with COT years ago with the chief executive who's trying to build a stadium in Belfast now, and just talking about something. And he said, I said, how does it work? And he said, one of the problems that he has is, and it's a structural issue, was he described it that when he deals with the HSE or in the south, they actually know the cost of everything, because it's sort of a mixed system and there's insurance involved. So they actually know the cost of an intervention in terms of acute. Whereas in the north, in the Western Health and Care, you ask, how much does it cost to do a hip? How much? They really can't, because they think, oh, the water bill and the rates, and they've never actually thought about it on that sort of a level. And maybe that's a bit of learning that could be taken from the Republic's healthcare system that has developed out of their hybrid thing. On the private one, I was at the BMA dinner that Alan Stout spoke about. The interesting thing on that was the GP from the south that came up and presented. I wasn't at the conference, I was at the dinner after because my wife was at it. But what happened, what he said was, he said that they were getting nearly twice as much to care for elderly patients in the Republic of Ireland on the public system. And he said the private work was the icing on the cake, but their public system is what keeps their GP. But they face exactly the same problems in rural areas as we do, with recruitment and retention in primary care and in the hospital service.
Absolutely. Thanks for that. I'm interested just we'll go to yourself first, and then we'll come back to the panel, because I'm keen to get the panel's views just on primary care as well.
All right, thank you, Paul McGoldrick here. I suppose very hard to come off for that one there. But I think what we're talking about here is a lot broader than rural exclusion. Like, as we know in the cities and stuff, there's as many people dying by neglect as there is in rural areas. But that man, he kind of alluded to it there about privatisation. And what is happening here, we're all living with the symptoms. We know the symptoms, we're living with them every day of the week. But Laurie, I thought you were going to allude to the root cause, but nobody has yet alluded to the root cause. What is happening here is, it's going back, I suppose, Thatcherism, late 70s, early 80s. We're talking about neoliberal capitalism, and you would know, Pat, from being a nurse and a trade unionist, what we are seeing here is the systematic dismantling of the NHS and why, for profit, to pave the way for the full privatisation of healthcare. And I've even seen it with my own two eyes. Father Brian, you've alluded that we all have to make a conscious effort in the retention of services at SWA, but there is a conscious effort being made at SWA, and I've heard different people over the years saying it's mismanagement. What's happening at SWA is not mismanagement. It is being managed exactly how it's supposed to be. Run it into the ground, make it look like it's no longer fit for purpose, and why for privatisation. I've seen with my own two eyes the private clinics working at the SWA, people coming in, handing the money over the table, but yet if you're sick in the morning you can get an appointment. And then even suppose there with Denzil alluded to on the national question, there's a lot of people that would maybe not vote for United Ireland because they want to hold on to the NHS. But the NHS, it is on the way out. When we talk from a Socialist Republican perspective, when we talk about a United Ireland, what we don't mean is an extension of the 26 county Irish Free State. We talk about a 32 county Socialist Republic. And I suppose that's the only fitting republic, or the only fitting way that suppose all people on this island, because what we're talking here tonight is class. Mary Lou alluded to it at the beginning of her speech about if you can pay, you'll be seen, and that's the same exactly here in the north. But then what if you can pay, so you pay twice, and people insist respectively the NHS is free. It's not. So we're already paying for it through our taxes, you know. So I think if we're serious with moving forward, we need to allude to the root cause and speak about the elephant in the room.
So Brian and Paula and Denzil, I'm going to hand over to yourself first, Brian, just in relation to some of the comments that you've heard and how you respond to them.
Yeah,
we're close to time, so...
Yeah, I wouldn't disagree with hardly any of them actually, but just because what they say is true doesn't help us to be any better. Because highlighting what is wrong doesn't give us a solution unless we come to the conclusion that people and people's health is more important than profit. That is where we have to realise. If it's a rural area, and there are special facilities right across the world for rural areas, it will take a bigger budget, but we deserve a bigger budget to do it because we have the right to health and health services. There's a lot of other things I would say about mismanagement and management. I'm afraid, the last time there was any recruitment drive for anything in SWA was 2021. So you can't say that people won't come here. They haven't been asked. And those who did come here were given 6 months contracts. So that is mismanagement.
Well, I certainly can't disagree with you, lad, about Thatcherism. I think the damage that it's done over many years, and I'm glad to hear you say about, in fact, the point has been made time and time again tonight, if we are looking at a new Ireland, whether it be health or a general point, that it has to be new, it has to be an agreed new Ireland, and certainly as regards health, I think there's a big opportunity there. I think tonight has been fantastic. I mean, some of the contributions from yourselves are way ahead of what we've been saying here, so well done. Particularly people with experience. Joe, was it? Yeah. Fantastic, and the experience of your wife as GP. To hear those experiences really sets out what the issues and the problems are. I used to work for a boss who used to say to me, when I go and complain about things, he used to say to me, don't bring me problems, bring me solutions. And I think we've heard a lot of solutions tonight, and I think going forward, we're looking at short term, medium term, and long term. I think a lot of the issues that have been raised, we can tackle some of them short term, but the big picture in the long term is an All Ireland health service. So again, thanks very much. Larry's words still resonate with me about common sense. There's a lot of common sense being talked in this room tonight. I hope, Philip, you'll bring some of that back with you to your colleagues at Stormont. So thanks very much, folks.
Paula?
I would agree, actually. I think there's been some really important contributions made from the floor and in the room, because nobody knows this region better than the people of this region, which is back to why I started, saying what might I contribute. But I suppose just listening to the two gentlemen here and here, first of all, speaking on behalf of your wife, I'd disagree if she was in the room, but I'll forgive you because she's not. But in relation to those things, basic principles, the Alma Ata Declaration was signed by governments, by the United Nations and by the World Health Organization in 1978. And in 1978, the Alma Ata Declaration described access to primary health care as a fundamental human right. Yeah. So that is where we need to start, that is where we need to begin, and that is where we need to finish. Yeah. So whether it's the NHS and it being, defunded, whether it's the HSE and, the slow speed of implementation of sláinte care, I do think there's a bit of cherry picking that we need to do. What does each system do well? Where have we had resilient services? Where have we had creative services? The lady at the front had talked about the community and voluntary sector. Like, if we were talking about cross-border healthcare, the community and voluntary sector delivers the only specialised unit for people with an alcohol-related brain injury on the island of Ireland. So that was set up, originally by Leonard Cheshire. It's now run by Threshold Services. So there are things like that are happening that we need to say, what would access to that look like on an all-island basis? How can we expand that service and that model of care that's happening? So there shouldn't be a baby or a bathwater here. I think we really need to sit down and say, what are the bits that are being done by brilliant, innovative, committed people who work within our health services? They may have been let down by leadership, they may have not had enough investment, as Stephen talked about. There may be all of those barriers, but some brilliant people have done some brilliant things and brilliant systems. So we have to have a cherry picking here that's driven by having access to primary care that is free at the point of entry. And that's worth fighting for.
So that brings us to the end of tonight. And I suppose for me, in my closing reflections of this evening, is that there hasn't been one person in this audience that has said that the way forward isn't on an all-island basis. That if we are to survive, if we're to move forward, if we're to make our services world-class and deliver for absolutely everyone, we need to do that for a population of 7 million, and the impact that will have on a rural area such as Fermanagh is evident for us all to see. So thank you for that. We need those services to be sustainable. We need, as Laurie has said, and I hope he's still here, that let's have a little bit of common sense for a change, and let common sense from the people drive the discussion, and for us then to lead the implementation. We need those services to be sustainable. We started off talking about sustainability, the benefits of being able to share data, and we've seen that throughout COVID across the 32 counties. That was another exemplar for us, and how we were able to work then. We know from the establishment of the Congenital Heart Service, we know from the development of the cross-border cancer services that are operating now in Alton-McGelvin. We know from the establishment, as Paula has said, about the All-Ireland Institute for Public Health and how that's seen us through COVID, and Mary Lou referenced that in her opening remarks. And we know that an All-Ireland approach to health will absolutely go a long way to addressing the clinical expertise that we need to hold on to in the north, and not have our people moving to Australia and elsewhere. And we want to retain our workforce to be able to make our services sustainable. And we need to make them attractive as well. So the viability of services moving forward is definitely on an all-Ireland basis. It's the people in this room that we have to listen to. We need to move this conversation forward at pace. We need the Irish government to listen to us, to listen to you. We will absolutely need to walk that journey with each and every one of you, and there will nobody be found wanting, certainly in our party, in doing that. So suffice to say, thank you so much for the brilliant contributions that everybody made tonight. I think this has been an incredible evening. Also just want to say a small thank you to the Westville Hotel for their hospitality, and to Conor McGee for providing the tech facilities. That's never easy to do, and there were many demands made of Conor, so thank you, Conor. Also just want to say, as well as it being an excellent meeting, really thank those people who shared personal testimonies with us, and that was really appreciated as well. There's no doubt that tonight's meeting does show us that people want to have this conversation, and we'll not be found wanting in continuing the conversation. But this is not a Sinn Féin only conversation. Everyone needs to get behind this conversation. This conversation belongs to everyone, and we need everyone engaged in it. And I think you've seen that from our independent panel tonight, and that's really, really important. So just to say that everyone that has attended, and if you've left your details, you will be sent a survey out after this, and we really would encourage you to share your feedback with us. So let's move forward together in our planning and preparing for a new Ireland, and I'm certainly looking forward to working with you all. So thank you and safe home.